Hello everyone, welcome to my YouTube channel. Today I'm going to be talking to us about something that someone had asked me in the past. Okay, so someone went for an interview and the person was asked, can you mention types of acute myeloid leukemia? What are types of acute myeloid leukemia? Now, there are so many things I'm going to be telling you along these lines because I want to cover everything, basically about it, okay? Now, before we get into it, my name is Dr. Emmanuel Ogbodo. I'm a biomedical scientist. I'm a lecturer in biomedical science here in the United Kingdom. So, yeah, let's get into this. Now, what I want you to know is that when such question comes, especially if you have gone through my videos in the past about maybe white blood cells, about something like peripheral blood film morphology, where I was talking about interpretation of blood film morphology, okay? Now, one of the things you are going to find out from there was I gave you a structure which you could see stem cell. Okay, and from the stem cell, I did highlight the fact that the blood cells are produced in the bone marrow, and before it can come to the blood system, it has to be matured first. So when someone take your blood, when somebody's blood is analyzed in the laboratory, what we should be analyzing in a healthy situation, the blood cells you're going to see in the sample will be matured blood cells. But then, in some conditions like leukemia, okay, what you're going to see that there may be a situation where the bone marrow is producing immature cells into the system, okay, meaning it pushing immature cells in the bloodstream. Remember that everyone has got immature cells. Immature cells are supposed to be in the bone marrow. Before the blood cells should be matured, it has to differentiate. And following the differentiation, then once it's matured, it can then be pushed into the bloodstream. But when the bone marrow push these immature cells into the bloodstreams, that indicates an abnormality. Now, why did I lay that foundation? I laid that foundation because I want you to know that when you go for interview, if you have listened to my video on peripheral blood film morphology, and they ask you what are types of acute myeloid leukemia, or what are types of chronic myeloid leukemia, or what are types of acute lymphocytic leukemia or chronic lymphocytic leukemia. Although I did not specifically mention that on my previous video, however, I did highlight the point. And what it means that if you have a good experience, you can be able to answer that question. Because what that question is asking you really, once you know what leukemia means, you can be able to answer the question. Once you know types of leukemia, what makes leukemia leukemia, you can be able to answer the question. But if you don't quite know what that means, then that question might throw you off. But hopefully today I will make it very simple and help you to understand that, okay? Now, let us go back to the blood cell differentiation. Once blood cells is produced in the bone marrow, so from the stem cell, it can differentiate, which I've already highlighted before on my previous video. It can differentiate. You have myeloid, you have lymphoid. So I say from the lymphoid, following the stages of differentiation, you can then get matured lymphocyte. And that is where you can see something like maybe B or T lymphocyte, okay? Now, and from the myeloid, you can get other blood cells, which are neutrophils, monocytes, eosinophils, basophils. You can even get red blood cells, and you can also get platelets, okay? Now, what happened is that during these stages of differentiation, any stage where there is a significant number of cells seen, okay, that is a type of that leukemia. Let me repeat what I said. During the stages of differentiation, any stage where you are seeing most of the cells, that tells you the stage, that tells you the type of that very leukemia. Now, let me give you an example. When you talk about let's say a good example would be from the myeloid lineage, okay? So from the myeloid lineage, you can get something like maybe pro-myeloblast, then you can get myeloblast, okay? You can get pro-myelocyte, you can get myelocyte. So it goes on like that. So these are stages. What it means is that if you are seeing more of pro-myeloblast, or you are seeing more of pro-myelocyte, what it means that the person has got pro-myelocytic leukemia. I hope this makes sense, okay? Now, if you have gotten significant number of myelocytes, what it means, the person have got myelocytic leukemia. Now, if you have gotten something like myeloblast, if what you are seeing is mainly blast cells from the myeloid lineage, which is myeloblast. Remember I said maybe from pro-myeloblast, you can get myeloblast, and it goes on and on, okay, until the cell become matured. So the stage where you are seeing the significant number of cells in the blood film is the type of that leukemia. So if you are seeing more of myeloblast, the person has got myeloblastic leukemia. If you are seeing more of myelocyte, the person have got myelocytic leukemia. If you are seeing more of pro-myelocyte or pro-myeloblastic leukemia or pro-myelocytic leukemia, this shows you the types. Now let's look at from the lymphoid lineage. So from the lymphoid lineage, you can see something like pro-lymphocyte. Now, when you see more of pro-lymphocyte, the person has got pro-lymphocytic leukemia. Now, and what it means that under that pro-lymphocytic leukemia, it could be mainly associated with B cell or T cells. So it depends on what is being associated with, okay? But what I'm trying to say that the stages you are seeing in that blood film morphology tells you the type of that leukemia. Another example may be when you see something like pro-lymphoblast. Pro-lymphoblast. That means that it is a stage before the lymphoblast. So pro-lymphoblast. So if you are seeing more of pro-lymphoblast, it means that the patient has got pro-lymphoblastic leukemia. So this is how you can be able to know the stage of the cells, and the stage of the cells you are seeing in the blood film morphology is the type of leukemia the person have got. Now, once you have known this, the next thing you then need to know is that when we talk about types of leukemia, it can be either acute or it can be chronic. So I first of all try to tell you the different stages. So in these different stages, the difference now is that is it at acute stage or is it at chronic stage? So when you say something like pro-lymphocytic leukemia, you may be referring to acute pro-lymphocytic leukemia or chronic lymphocytic leukemia. Leukemia can be either acute or chronic. Whether it is acute lymphocytic leukemia or chronic lymphocytic leukemia, the type of either acute lymphocytic leukemia or acute myeloid leukemia or chronic lymphocytic leukemia or chronic myeloid leukemia, the types is dependent on the cells you are seeing, the significant amount of the cell or the cell that you are seeing in the blood film morphology. Now, for example, if you see something like pro-myeloblast, what it means that the person could be acute pro-myeloblastic leukemia or chronic pro-myeloblastic leukemia. Now, if you see something like pro-lymphocytic leukemia or pro-lymphoblastic leukemia, what it means that the person could be acute pro-lymphocytic leukemia or acute pro-lymphoblastic leukemia, or the person can be chronic lymphocytic leukemia or chronic pro-lymphoblastic leukemia. So the point I want to make is that when you go for interview and they ask you what are the types of acute myeloid leukemia Or they could say, what are the types of acute lymphocytic leukemia? They may even say, what are the types of chronic myeloid leukemia? Or what are the types of chronic lymphocytic leukemia? What you need to focus on once such a question is asked and they've given you blood film morphology is to look at what are the cells you are seeing there. Okay, now obviously if it is asked based on theoretical question, you should give answer. Now if they say what are the types, I'm going to give you the example, but I really want to focus in a situation whereby they've given you a blood film morphology to look at. If blood film morphology is given to you to look at and they say what is a type of leukemia there, what you need to focus is that what type of cells are you seeing? If you are seeing pro-lymphocyte, it means that what you may be looking at could be either acute pro-lymphocytic leukemia or chronic pro-lymphocytic leukemia. If what you are looking at is myeloblast, what it means that you may be looking at acute myeloblastic leukemia or chronic myeloblastic leukemia. So it depends on what you can see there. Now, let us look at few examples. Myeloblastic leukemia. So, in terms of myeloblastic leukemia, what it means that there is a significant amount of myeloblasts. Remember, from the stem cells, they will differentiate into lymphoid and myeloid. So, the first stage, you might get something like pro-lymphoblast, or you can get pro-myeloblast. So, when we say blast cells, is generic. So when we say this is a blast cells, what it means that you are being generic, that terminology is generic. So, but you can be more specific by saying myeloblast, or you can be more specific by saying lymphoblast. So when you say myeloblast, you are saying that the blast cells you are seeing is from the myeloid lineage. If you say lymphoblast, you are saying that the blast cell you are seeing is from the lymphoid lineage. Now, in some cases, you might see something like pro-myeloblast or pro-lymphoblast. What it means that the blast cell you are seeing is the stage of the cell you are seeing is not yet a blast cells. It is a stage before the blast cells. So what it means that if you see pro-myeloblast, what you may be looking at if they are giving you the blood film morphology could be acute pro-myeloblastic leukemia. You see it now? Or if it is from the lymphoid lineage, you might be looking at acute lymphoblastic leukemia. Vice versa, it can also be chronic myeloblastic leukemia if it is from the myeloid lineage, or chronic pro-lymphocytic leukemia if it is from the lymphoid lineage. I hope that makes sense, okay? So now, if you say myeloblastic leukemia, you are saying that you are seeing more of myeloblasts. In fact, let me put it this way: you are seeing more of blasts that are from the myeloid lineage, and because you think that they are from the myeloid lineage, you call it myeloblast, and therefore you can be called myeloblastic leukemia. And what it means is that depending on what you can see from the morphology, you can call it acute myeloblastic leukemia or chronic myeloblastic leukemia. And of course, like I've said, that could also be from the lymphoid lineage, so it could be lymphoblastic leukemia. What again, it means that you may be looking at either acute or chronic lymphoblastic leukemia. I hope this is making sense. Now, let's look at another type of cell. Another type of immature cell may be promyelocyte. So when you see promyelocyte, remember, I want you to go and study the cell differentiation stages, which obviously I've highlighted on my previous video, okay, on blood film morphology. Now, when you look at that, you're going to see one of the stages is promyelocyte. From promyelocyte, you can get myelocyte. So if what you are seeing is more of promyelocyte, what you may be looking at could be acute promyelocytic leukemia or chronic promyelocytic leukemia. That is if it is from the myeloid lineage. Now, in some cases, you might get what we call myelomonocytic leukemia. Myelomonocytic leukemia. What it means then is that in that blood film morphology, you are seeing significant amount of monocytes. You see it now? It is a leukemia and you are seeing more of monocyte, because monocyte is from the myeloid lineage. Don't forget, okay? Apart from the lymphocyte, the rest of the blood cells are from the myeloid lineage. Now, because it's from the myeloid lineage and you'll see more of monocytic cells, okay, that could be either immature or mature, as the case may be, you'll see more of monocytic cells, you can then call it myelomonocytic leukemia. Myelomonocytic leukemia. What it then means again, it can be acute or chronic myelomonocytic leukemia. The word myelo is telling you that it's from the myeloid lineage. The name of the cell, like on this occasion, monocytic, is telling you that what you are seeing is more of monocyte. Now, in some situation, you might see something like monocyte, that you might see some eosinophils, you see some monocytes, okay, in the case of leukemia, okay, and because two of them are from the myeloid as well, you can get what we call myelomonocytic with eosinophilia leukemia, meaning there's a combination of monocyte and also eosinophils, okay, in that leukemia. Then that is a type of that leukemia, okay. And this is where I may want to highlight something like, maybe you can see something we call AMML, or you can get something what we call CMML, which is where you can get acute monocytic myeloid leukemia. What you are just saying that there is more of monocyte. Acute, we've already explained it on my previous video, okay? One of the ways you can differentiate acute from chronic is that with the acute, you see more of blood cells, okay? But with the chronic, you can see few blood cells and with more of maybe few cells that have differentiated. Some of them may be matured, some of them are still not matured, but they have passed the stage of blood cells. Does that make sense? Now, the point I want to make is that, so when we say AMML, we're saying acute monocytic myeloid leukemia. What it means that when you look at the blood film, you are seeing more of monocytes and you are seeing some blood cells. It is enough indication to know that this is talking about acute monocytic myeloid leukemia. Acute because there is more of blood cells. Monocytic because you are seeing monocytes. Myeloid because it's from the myeloid lineage, and of course leukemia. Now, that is why you can know the difference between AMML and AML. So when you say acute myeloid leukemia, it is not generic, because from the myeloid, it could be from the monocytic, it could be from the neutrophils, it could be eosinophils, it can even be megakaryocyte like platelets, or even from red blood cells. So depending on what you can see more, okay, the only difference is that when it is mainly associated with neutrophils, you can stick with acute myeloid leukemia. But when it's associated with monocyte, you can then call it acute monocytic myeloid leukemia, or acute monocytic myeloid leukemia with eosinophils, as the case may be, depending on what you can see. Now, in some cases as well, you might get something we call erythroid leukemia or erythroblast. Okay, what it means again is that that leukemia from the myeloid is affecting mainly red blood cells. Does that make sense? So when it affects mainly the red blood cells, you are looking at erythroid leukemia. Then, if it affects platelets, megakaryocytic leukemia or megakaryocytic leukemia. So, depending on what you can see, if you are seeing more of megakaryocyte that's associated with blast, you now call it megakaryblastic leukemia. But if you don't see more of blast and you are seeing mainly, immature platelet, which is megakaryocyte, you can now call it megakaryocytic leukemia. So, these are what I'm really trying to explain here is that when they ask you what are the types of acute or what are the types of chronic leukemia, the best way to know the answer is, if they give you the morphology, is to ask yourself, which cell am I seeing? The cell you are seeing, depending on the stage you can identify, will help you to know the type of leukemia you are dealing with. Okay? Now, there are other types of leukemia where you can get something like myeloma. And once you hear the myeloma, it affects more of the lymphocyte, okay? Now, there's a difference between myeloma and maybe, because people mistake myeloma with lymphocytic leukemia. So one of the things I want you to know that myeloma is mainly associated from the plasma cells, and plasma cells obviously is from the lymphocyte lineage. So, and these plasma cells, they play a role in the production of the antibodies, okay, to fight infection. So now myeloma is produced from the plasma cells, which is also from the lymphocyte lineage. Now there's also what we call lymphoma. Lymphoma is also another type of leukemia. Now, in lymphoma, what happens that you can have Hodgkin lymphoma or non-Hodgkin lymphoma. The difference between two of them is that depends on the type of the lymphocyte affected. For example, there's what we call stem cells. So it's a type of lymphocyte, okay, or white cell that has more than one nucleus, okay? So it's called stem cells. So in Hodgkin leukemia, you can see stem cells, while in non-Hodgkin lymphoma, there will be absence of stem cells, okay? But what I want you to know with the lymphoma is that lymphoma, unlike lymphocytic leukemia that is from the bone marrow, okay? Now, but lymphoma is more of lymphatic system that target lymph node. That is lymphoma. Now, you can also have what we call hairy cell leukemia. In hairy cell leukemia, so if they give you a blood film morphology and you are seeing cells with some hair, okay, because you can see cells with some hair, you can call it hairy cell leukemia. That means that the type of that leukemia is unique because the cell has some hairs. So you can call it hairy cell leukemia. There's also another type of leukemia which we call myelodysplastic syndrome, which is called MDS in short form. One of the ways you can know if they give you blood film morphology that this is MDS, okay, is that you're going to see cells that are not healthy. You're going to see mainly unhealthy cells, okay? So what it means that in myelodysplastic syndrome, you're going to see significant low amount of healthy cells. The cells you are going to see are going to be mostly unhealthy cells, like immature cells, okay? Myeloproliferative disease or disorder, okay? Now, what it means is that with this one, as the name suggests, proliferatic, there is more production of white cells. So these are the types of leukemias that you can see. Now, let me see if I can put all of this into context to help us to understand it better. Now, if you go for interview, you already know leukemia can be either acute or chronic, okay? Now, once you have known these two, the next thing that can help you is to know which stage, because there are different stages. Any stage of the cell differentiation you are seeing in the blood film morphology determine the type, either from the acute or chronic. Now, example is when I say something like promyeloblast. If you are seeing more of promyeloblast, it could then mean that you can be looking at acute promyeloblastic leukemia or chronic promyeloblastic leukemia. And the same thing can also be seen in lymphoblast, where you can see pro-lymphoblast. So when you say pro-lymphoblast, it means that it could be acute pro-lymphoblastic leukemia or chronic lymphoblastic leukemia. Now, from pro, the next differentiation will be myeloblast or lymphoblast. So when it is myeloblast, you can now be talking about something like either acute or chronic myeloblastic leukemia. If it is from lymphoblast, you can be talking about either acute or chronic lymphoblastic leukemia. I hope that makes sense. Now, from the myeloid, you can get something like promyelocyte. Promyelocyte. What it means that it can be either acute promyelocytic leukemia or chronic promyelocytic leukemia. Your decision on being specific in that naming is because you are seeing promyelocyte. Now, the same thing as well, when you come to the lymphoid lineage, you might see something like pro-lymphocyte. Pro-lymphocyte. Now, when you see pro-lymphocyte, what it means that you may be looking at either acute pro-lymphocytic leukemia or chronic pro-lymphocytic leukemia. Again, your decision in calling that name pro-lymphocytic, either acute or chronic, is because of the pro-lymphocyte you are seeing. I hope this is making sense. So what I want you to understand that when you go for interview and they ask you the types, focus on what type of cell am I seeing. Once you know the type of cell you are seeing, you can be able to answer that question. For example, from the myeloid lineage, you are seeing some monocytes, okay? You are seeing some blast cells, you are seeing monocytes. You are looking at either acute or chronic monocytic myeloid leukemia. You see it now? You are making that decision because there is significant amount of monocytes and there are some blast cells. You see it now? Now again, and because if you see more of the monocytes and they look like blast cells, you can actually be more bold to call it monoblast. You see it now? Okay. Now again, you can also look at that from in terms of maybe CMML, which is chronic monocytic myeloid leukemia. You are also making that decision because you're seeing more of monocytes and some blast cells. You see it now? So these are how you can be able to know different types of leukemia, whether it is chronic or acute. Once again, I have said that chronic means there is less amount, maybe less than 20 or 30% of the blast, okay? While with the acute, you are seeing more than 30% or more than 20% of blast. Does that make sense? That is the difference, okay? So once you know that that is the difference, you then need to ask yourself, what cell am I seeing? What stage of the immature cell am I seeing? The stage of the immature cell you are seeing is the type of that leukemia, either acute or chronic. I hope I've been able to make this simple and easy. So yeah, here you go. And if this question come like theoretical, they didn't show you blood film morphology, and they say what are the type of maybe leukemia, let's say what are the type of acute myeloid leukemia, you can say acute pro-myeloblastic leukemia, you can say acute myeloblastic leukemia, you can say acute pro-myelocytic leukemia, you can say acute myelocytic leukemia, you can say acute monocytic myeloid leukemia. You can mention any of those things. It depends on the stages. And of course, if it is also asked in terms of what are the types of chronic myeloid leukemia, the same thing. You can say chronic pro-myeloblastic leukemia, chronic myeloblastic leukemia, chronic myelomonocytic leukemia, or you can say chronic monocytic myeloid leukemia. It all depends on the stage of what you can see. And the same thing is applicable when they ask you theoretically as well in lymphocyte. You can say acute pro-lymphoblastic leukemia, acute lymphoblastic leukemia, acute pro-lymphocytic leukemia. The same thing can also go with the chronic. Okay, so that is how you can be able to know different types of leukemia. So if you go for interview, they ask you types of any leukemia. If they show you blood film morphology, you need to ask yourself first, is it acute or chronic? How will you know? If you see more of blast cells, it is acute. If you see small blast cells, or you don't even see blast cells, it's mainly immature cells that have passed blast stage, okay? You are seeing some mature cells as well. Then you know that that is chronic. Once you have known that it is acute or chronic, the next thing you need to ask yourself, what other type of cells am I seeing there? If you are seeing myelocyte, it means depending on what you can see. Now, if you think it's chronic, you can say chronic myelocytic leukemia, and that is just how you can do that. Okay, so the next time what I'm going to do is to present blood film morphology so that we can see this thing that I've said in a practical way. Okay, so we can interpret these types of leukemia. But I thought I should give us overview so that when you go for interview and they ask you types of leukemia, you will know what to say. I hope that makes sense. Please let me know what you think about the video, and if you have any question, put it on the comment section. Can I ask you to like, share and subscribe? Thank you very much, and I wish you all the best. Bye bye.